Miss Faith. I'll be your baby's nurse today. I've come in to check on your baby, get some vital signs, and do an assessment. Is that okay? Wonderful, thank you very much. I'm going to have performed hand hygiene, and I will have ID'd my patient here. First thing I'm going to do with the baby is listen. If the baby is covered in Vernex, wear gloves, but mine is not. So I'm going to uncover the baby just enough to do my checks. I don't want to risk the baby getting too cold during this. So first things first, I'm going to listen for lung sounds. My baby's lung sounds are clear. However, you may still experience crackles, which could indicate a bit of fluid in the lungs. Now, I'm going to look, listen, and feel when taking my respirations. This means I'm putting 2 fingers on the baby's abdomen so that I can easier count respirations. Very good. My baby's respirations are normal. They'll be 30 to 60 per minute. Now, I'm also going to listen to pulse, so I'm going to do so for a full minute. The baby's heartbeat may be irregular, and you may experience murmurs within the first 24 hours. That's to be expected. My baby's heart rate should be between 110 and 160 beats per minute. Awesome. One more. I'm going to listen to each quadrant of my baby's abdomen. His bowel sounds are all active. Alright. Now we aren't going to take the baby's blood pressure. Usually we only do that if it looks like there might be a problem cardiovascular. However, I am going to take my baby's temperature. Axillary under the arm. Your baby's pulse should be between 97.7 and 99.5 Fahrenheit. My baby's temperature is normal. Alright, now we need to look at the baby's head. When you look at the baby's head, take off the hat. You're going to want to lift her head up while supporting the base of the neck, the back of her head. I'm going to run my fingers over the baby's head, smooth circular motions. I'm checking for overlapping and molding. Molding is commonly seen. The baby may have a cone-shaped head, or, as I said, overlapping of plates. This will resolve on its own. Something else I need to check are the suture lines. If the space is greater than 1/4 inch, that is abnormal. You will be able to feel a flat spot on the anterior and posterior sides of their head. Now, something else I want to look for is any bruising, scratching, or soft tissue injuries. Birth can be pretty traumatic, and on top of that, if we used any instruments such as forceps, this could have caused injury to the baby. Now, the difference between a hematoma and a kappa is fluid. It's going to be very generalized and feel squishy. A hematoma is blood, and it's a hard spot that it never crosses the suture lines. Babies with hematomas are more likely to develop jaundice due to the reabsorption and breakdown of the blood. Now I want to look at my baby's eyes. We'll put the hat back on just for right now. Conserve that body heat. I need to check to see that my baby's eyes are both wide and in between 1/3 of an inch. Have proper alignment. Now my baby's eyes. Are there epithelial folds? If there are, is the baby of Asian ethnicity? If not, this could tell us Down syndrome. We want to look at the eyes a little bit further. Is there any subconjunctival drainage? Any crusting? Do I see any subconjunctival hematoma, whether the baby's eyes are bloodshot or there might be a bit of bleeding in the sclera? Line up the baby's eyes with the top of the ear. Low set ears can also indicate Down syndrome. When checking the recoil of the baby's ear, my baby's is brisk, which means this is a full-term infant. If the ear appears slow or sluggish, this could tell us that this is a preterm infant. Now, to check the patency of the nose, gently hold down one nostril at a time. You should feel the baby's breath coming from whichever is not covered. Next, you're going to put on gloves so you can check the baby's mouth. Give the baby your finger to insert and check for the sucking reflex. Your baby should immediately try to root. Turn your finger so that you can gently palpate the soft and hard palates. If you feel a gap or an opening, that is abnormal. Go ahead and take your finger back and drop your gloves. Next, I want to check the baby's neck for any masses. I'm going to uncover my baby a little bit. Check the clavicle. No masses were found. Now from the back to the front, you're going to be checking for crepitus, asymmetry, any bruising or give, and with the asymmetry, you might see a flaccid arm. This could tell us that one of the baby's clavicles are broken, and this is more common in larger infants. Okay, we checked that. Let's look at the baby's chest. I've already listened to the lung sounds, so we're going to be looking at the chest for the 5 signs of respiratory distress. You might see the baby's nostrils are flaring. Maybe the baby is grunting. Episodes of apnea 20 seconds or longer are abnormal. If you look a little further down, you can see retracting. You'll see the skin sucking up between the ribs, or even seesaw breathing, where the abdomen and chest don't line up with one another while taking in breaths. Let's look at my baby's abdomen. We want to see a round, soft abdomen on a baby. You do not want them concave. Palpate for masses. Does the baby appear to respond with any painful stimuli? If so, that is also abnormal. Now look at the baby's umbilical cord. The clamp is a way we can ID the baby, so we'll continue wearing it till they go home. Check Rita. Is there any redness, edema, ecchymosis, or drainage? These can all be signs of infection. If you see any crusting around the cord, you can take warm water and soap and just try to gently brush it. Do not scrub, as you can cause an injury. The cord will dry on its own, and you can check for how dry it is. Generally, we leave this alone so that nature can run its course and it can fall off on its own. Just be sure to make sure the cord is never inside the diaper, as the infant can urinate on it. Okay, we're going to do a skin assessment. So unfortunately, I'm going to have to uncover my little guy. We're going to take the hat back off, and we'll say we're underneath the wonderful sweet radiant warmer. And we're going to get all the way undressed, safe for the diaper. And I'll uncover as I look. Something to look for. We were looking for soft tissue injuries. Are there any scratches or bruises? Are there birthmarks? Are there any stork bites on the forehead or the nape of the neck? Do we see any acrocyanosis of any of the extremities? It'll be a blue palish color that we often see more in preterm infants. Is there a newborn rash on the baby? Something else we can look for in babies who are not Caucasian is the Mongolian spot, a little bit of a darker pigmentation at the base of the spine. Another thing we should check for right now is jaundice. Very gently apply pressure with your thumbs and blanch the skin of the forehead, the chest, and the thigh. Did it come back a pale yellow? Now look at the eye. The sclera of the eye should be white, but in jaundice it could be colored yellow. Alright, warm my baby up a little bit more. Put the hat back on. At this time, I want to check the baby's diaper and genitals, so I need to go and put on gloves. Open up the diaper. If the diaper is soiled, change it. But my baby's diaper is dry currently. I have an uncircumcised male. That means his foreskin is intact. I also see that he has rugae on his scrotum. The less rugae, the more likely the baby is preterm. The coverage of rugae tells us that the baby is full term. Now I'm going to insert my gloved fingertip in the inguinal canal between the thigh and the scrotum. And I'm going to use my thumb and index finger to check to see if the testes have descended. And I'll do the same thing on the other side. Now, I'm also going to look for the urinary meatus. It should be at the tip of the penis. If it is not, it's abnormal. It's easier to see if it's abnormal in kids that have been circumcised. If your child is not circumcised and you're looking, do not retract the foreskin. That cannot safely be contracted until about the first 2 to 3 years of the baby's life. Now, in a circumcised baby, you may see redness, and you could even see a petroleum gauze pad attached to the end of it. In female patients, you want to see if the labia majora covers the minora. If the minora and clitoris are exposed, this is most likely a preterm infant. You might also see a white discharge in female babies, and this is normal. The mom's hormones cause this. Along with that, it could be a spotty, slightly bloody discharge. Put that baby back on. Okay, let's check the hands of our baby. How many digits are in each? I count 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Same with the toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Any more or less is abnormal, called polydactyl. Look for any webbing between the fingers, or see if fingers are fused. Same with the toes. Now you're going to turn your baby onto their front, supporting them, so that you can look at their back. Obviously, they'll be a lot softer than this. Check the baby's spine. Is it straight, or do you see an abnormality? This is also a good time to look for those stork bites in the Mongolian spot. If you see a tuft of hair or a dimple at the base of the spine, this is abnormal. This could tell you that there was poor spinal closure or fusion. Now, we do not check for hip dysplasia, the doctor does, but we can still look at the creases of the gluteal and the thighs and see if they line up. Turn your baby back over. You finished up your full skin assessment. The next thing I want to do with the hips, I want to put the baby's feet flat on the ground. Are the knees the same height? You can also see the gluteal lines. Do they have that smile as one calls it, or are they symmetrical? Next thing I want to do is test the baby's reflexes. You can either pick up the crib and drop it, you can clap, you can make a loud noise against the bed, and it's called startle. You'll startle the baby and their hand should come up and make a C motion. Another reflex you can test on the baby will be the Babinski. With an inverted J, you'll come up the bottom of the foot and across the ball of the foot, and that'll make their toes fan out. While you're down here, you can check for creases. The baby should have a nice crease about 2/3 down the foot. If it is smooth, it tells us that the baby may be preterm. Along the hands, you'll see about 2 to 3 creases. If there's only one, this could tell us that the baby has Down syndrome. Something else to have kept in mind, I mentioned vernix in the beginning. You can still, as you move the baby, you may see vernix in the creases and wrinkles, and that's completely normal. One more reflex to do. You're going to raise the arm, or you're going to hold the baby's arm down. You're going to gently raise the arm to them, and you're going to put that baby's arm back down. Arm recoil, you do this with both. The baby should automatically reflex their arm for you again once they've been let go of. Throughout this, you should have paid attention to the baby's behavior. Were they fussy? Were they sleepy? Was there a lot of crying, or was there a strange absence of noises? If the baby was crying throughout all this and their heart rate was high, we can understand that that would be completely normal. But if the baby seemed lethargic or asleep and their pulse was too high, that could be a concern. After you've got this baby all bundled back up and dressed again, ask mom, how often is your baby eating, and are they tolerating feed very well? About how often is your baby going to the bathroom? Are they urinating and passing stool? When you had changed their diaper, you would have put that as I&O. Have you noticed any difficulties with your baby? You're going to have washed up your hands and ask the mom if she needs anything else at this time. Mom says no, baby's good to go, we're all good, and we can leave.